Hey everyone, and welcome back to my channel. Today I am basically going to be getting right into it, going all the way back to the beginning of basically when I was first seeing signs, symptoms. Hadn't gone to the doctor yet, but I will put up a disclaimer. So in case, because this is sensitive material, medical jargon, personal stuff. If you're not into that, you can kind of just fast forward through that or skip the video altogether. So basically my journey kind of started in October of 2022. I was working full time, just living day to day, not really paying attention to body, anything like that, just going through the motions, getting up, going to work. Right around that time, I kind of noticed that my right side, my breast, the nipple had kind of inverted a little bit, but that had happened in the past when I was a teenager. So I was just kind of attributing that to, oh, I'm getting older. Maybe it's come back. Didn't think much of it. There was a little bit of puckering, a little bit of sagging. I thought, again, age. It's not that big of a deal. So kept going about my days. Had some stress at work, things like that. Just didn't pay much attention to it. Kept going. Halloween came and went, one of my favorite holidays of the year. Then right around in December of 2022, I started having some pain in that right area. Just when I would get stressed out or when I would touch it, it wasn't like constant. It was more like, a throbbing here and there. Take some Tylenol for it. I thought maybe I had pulled a muscle or something. I was doing quite a big reset at my job at the time. Reset, basically removing everything around in the department from one spot to the next, moving shelves. So I figured, I'm just working really hard. I probably pulled something. Yeah, didn't think much of it. Then I guess it was probably it was February of 2023 that my husband actually happened to just sneak a peek at me in the shower, as husbands do sometimes. And he did notice. He's like, "What's that?" And I looked down. I'm like, "Oh, that's been there for a little while." By this time, you could actually see sort of a prominent lump. It almost looked like I had one of those little mandarin oranges kind of nestled right on the top of my breast, just kind of peeking out. So I figured, you know what, it's probably time to maybe go see someone. So that was a Friday, I believe. So the next day was a Saturday. We just went to a walk-in clinic. Had a nice nurse practitioner. She examined me, and right away she's like, "Yep, we're going to get the tests, all the tests. I'm going to book all this in. This needs to be addressed." So she was kind of putting me on high priority because of the size and the visualization of it, I'm thinking. So she booked me for bone scan, MRI, mammogram, biopsy, CT, all those things. I got in fairly quickly. I believe it probably was kind of urgent because of the size. In the end, I believe it kind of measured out to be around a 7-centimeter lump. And this was in me the whole time. And I noticed it, but I didn't really pay attention. So I guess it was pretty urgent. Yeah, they did the biopsy. And when they did the biopsy, they did find node involvement, they call that. They weren't quite sure if the cancer was in the node, but they did mention fluid around it. So they sent biopsy away to get all looked at and checked. And while all these scans and tests and things were done, I was trying to keep positive, thinking, you know what, I'm healthy. Nothing's really ever happened to me my whole life. I've been pretty normal, you know, no issues with heart or anything like that. So I'm like, it's probably nothing. It's probably nothing. So my biopsy results came back on about March 3rd. And it turns out that I was cancer positive. Like I said in my first video, they classed me as stage 3 invasive ductal carcinoma. They bumped me up to a stage 3, I believe, because of the node involvement, the suspected fluid. So that was why I got bumped up to that lovely number. And I was also triple negative with that. So the lump size, like I said, about 7 centimeters. So it was growing at quite a rapid speed. And I think they said something like it was doubling every 180 days. So they kind of really wanted to get me into the first few, you know, meetings and things with an oncologist team, so that we had a plan. I was then sent to the local cancer center here. It's not in my town, but it's about an hour away. It's called the Blair Cancer Center in Regina, Saskatchewan. I was hooked up with a wonderful team. My oncologist, I had a social worker, all that kind of stuff right off the go. So they kind of had to make a plan for me. So because I didn't just have a desk job, I was in a very physically demanding job, a lot of lifting, carrying, pushing, pulling, all that thing, being at a home improvement store. She gave me the option of going off of work until I was ready to go back after all of my, you know, stuff that I had to get done, my treatments, things like that. So I was done work around early of March of 2023. So unfortunately I did have to go on leave, but I believe that I did need that time. I don't think there was any way that I could have done the chemo and all of that while still going to a full-time job that was so physically demanding. I had also been set up for a surgeon in all of this, as discussed by my oncologist. My chemo plan was going to be 2 phases. I was going to have 2 phases of chemotherapy, then a double mastectomy, and an oophorectomy, and then radiation. And an oophorectomy, if you don't know what that is, it's where they basically take your ovaries and your tubes. My particular cancer, it really likes estrogen, and it feeds off estrogen. So they had to get all the estrogen out of me so that it just doesn't keep growing. So that was going to be set up. Turns out that I got both the double mastectomy and the oophorectomy in the same day. So I only had to be put to sleep once, which was nice. She also got me into an immunotherapy trial. So I am on Keytruda. So that was basically to boost my immune system to fight the cancer, to recognize the cancer, find it out, fight it. So make my own body stronger to kick the cancer's butt along with the chemo. I got that every 6 weeks. There was few weeks here and there that it was postponed because my blood work numbers just weren't healthy enough. So I would have to, you know, take an extra week just to rest. The first phase of my chemo plan was I was going to go every 2 weeks. I got 2 drugs and I did 4 cycles of each. My phase 1 meds were, I'm not sure if I'm saying this right, cyclophosphamide and doxorubicin, which doxorubicin a lot of people call the red devil. It's a really heavy hitter right off the bat. I think they give it to you at the beginning because your body's strongest. It hasn't been weakened by any other immunotherapies or anything like that, any other, you know, medical stuff. So you're going into it strong, which you really need to be, because I found that that one really knocked me down. My immunotherapy was called Keytruda. That's the one that I was on, and I'm still on actually. Pembro is the technical name, I guess. Big long name. So my first chemo was March 21st. I had a lot of flu type feelings with these meds. It hit me pretty hard. No appetite, weird cravings all the time. A lot of times I would crave like things like melons and salads. I mean, they're not necessarily weird, but you know, I just didn't want to look at any other food except for fresh stuff. So I think my body was trying to get all the nutrients it could while it knew I was putting it through this. I had headache, slight nausea, but I had a lot of pre-meds and stuff to take care of that. I wasn't like on the floor being sick or anything like that. I just felt really kind of just wiped out, lousy, on the couch a lot, just the normal things that I would normally do, you know, like wanting to go and have a bonfire or something like that. I didn't want to do anything. I just wanted to lay around. So it kind of took your mood really down, and you just wanted to just be gross on the couch. So that's kind of what I did. My husband was so good. Every time I'd ask for something, have a craving, he would go out and get it for me, and I'd try something new to eat. I did drink a lot of the chocolate boost. That was kind of my favorite go-to thing to get any nutrients in me. So I started my chemo. They were giving it to me through just my regular veins. And then I decided, you know what, maybe I should get a port put in. So if you don't know what that is, I'll try and put a picture up here. So a port, basically, it's a way to get your medications to you, to take blood without going through your veins in your hand. It's inserted into your chest. So they inserted mine on my left side, my non-cancer side. I still have the scar here. I've actually since had it removed, but more on that in another video. So I had the port installed around April 18th of 2023, just a little bit after my first chemo. So it kind of went under my skin and into like one of my main veins in my neck here, and then that's kind of where they would like kind of hook all the meds, chemo up to. So one poke in my chest as opposed to trying to find a vein every single time, veins collapsing, stuff like that. So it's just more convenient for the nurses. It's in a way more comfortable for me, kind of like that. So that's, a lot of people had it. A lot of people said this was the thing to do. So that's what I did. So when they put a port in you, they also put what is called heparin in the line to keep it kind of open and fresh and non-clotting so that your blood doesn't clot in that line. Well, me being weird, my body, turns out that I had a little bit of a heparin allergy. So they would put the heparin in me after my chemo was done. I'd go home and my throat would kind of start to feel a little tight. And within about 48 hours or so, my voice would start to diminish, almost like I was losing my voice, like I had a cold. So within about 48 hours, I had this tiny little croaky voice, and I didn't know what was going on. So there was that. So it turns out that they actually had to remove the heparin from my port, and within about half an hour, my voice came back and my throat opened back up. Unfortunately, in my province, there's nothing to put in place of the heparin, so a lot of people do keep their ports open with nothing in it. So that's kind of what I did. I just had to kind of get it regularly used or flushed every, I can't remember how many weeks it was, just to keep it kind of clean and open so that there wasn't clotting, because there's always a chance of a clotting happening in that empty line. I was also sent home with what they call Grastofil injections. I had to give them myself. They're like a little pre-filled syringe, like teeny tiny little needle, that basically keeps my white blood cells up, I believe it was, while I was on that first phase of chemo. I think I gave them to myself like every day for like 7 days. I just gave them to myself in my belly, either side, kind of one on one day, one on the other. It wasn't a big deal. I got quite used to it. Like I said, it was a small needle. The day before my second chemo, I had to have my hair shaved. It started to come out around April 3rd, 2023. I was just in the shower, washing my hair, and I would grab a handful, just as you do when you scrub your hair, and I was having strands come out. So started to cry, obviously, because that's a big part of me. It was a little shocking. I knew it was going to be happening, but I had had my hair cut shorter a few weeks before by my wonderful hairdresser, and just to make it easier, because I did have quite long hair before all this, down to about past my shoulders. So I just thought I'd just, do the transition slowly. So my husband, he got out the clippers and he shaved my head for me. I remember I was sitting at the kitchen table and I was crying, and my son, my 20, I guess he was about 20 then, was holding my hand during the whole thing as I cried, as I watched my hair fall to the ground. But it was a necessity to have done. Everybody goes through it. There are things called cold caps and things that you can use to help save the hair while you're getting the chemo, that you can wear, you can rent them, that kind of thing. I wasn't really interested in that. I just wanted to get it off, and I would start fresh with new hair. I mean, my hair had been damaged from years of bleaching and whatever anyway, so it was a fresh start. The next few chemos, I still had some symptoms. Then it was time to get my port in. I got my port in around April 18th. That did go well. Wasn't pleasant, but it's kind of what I wanted. So this was going back a little bit. I know I already talked about the port, but the actual port install date was April 18th of 2023. It was about an hour-long surgery. I was awake for it. I say not the most pleasant thing. You had to do some tunneling. Not pleasant, but I didn't really feel it. A little bit of pressure, as they say. But like I say, about an hour. It was a day surgery. I was out. Then, unfortunately, because I had gotten chemo and my immune system had been taken down a little bit, and then I went in for this port surgery, I had kind of unknowingly, I guess, taken down my strength, and I kind of had to go to the hospital. I went downhill. I couldn't keep food or water down. This was around April 22nd. I felt weak. I felt shaky. I couldn't even like grab the milk out of the fridge. Like that was just too heavy. It was too much. So my husband took me to the ER. I got fluids. I got blood tests. I was treated for what the local hospital thought was sepsis. But turns out that I really just kind of needed my Grastofil in the end. So we kind of collaborated between my hospital, my local hospital in my town, and the Blair Center, and they had to communicate. And basically, as soon as I had the Grastofil injection, I started to perk up, started to get a little bit stronger. So I think the shock from the port and the chemo was just too much for my body. So if I had to do it over again, I would definitely do the port first before I went into any chemo kind of situation, because it's just me personally, my body just couldn't handle having both at the same time. It's just, it didn't know what was happening, and it just crashed. So I'm very thankful for my local hospital. They took the best care of me. Nurses were great. So they eventually got me up and running again. Eventually I was released. I think I was maybe in hospital for maybe a week. I can't quite remember. And I was sent home to continue. So I kept going with my phase 1s. My last phase 1 chemo was May 9th of 2023. So that was the first set of drugs that I had finished. I will say a side note here, that about in May, I was put into basically full menopause because of the chemo drugs. My period stopped. I got really bad hot flashes, kind of moody. So I can't remember if it was about that time or a little bit farther down, but my gynecologist suggested that I go on something called clonidine. I think it's like a heart pill, like high blood pressure pill. I don't have high blood pressure, but it can control hot flashes. And for me, it took them about 50% down. So the severity and the duration and the intensity of them. Instead of my neck dripping wet, I'd feel it still, but it wouldn't be as intense. So then I started phase 2 of my chemo, which was a whole new set of drugs, still being on the immunotherapy. So about May 23rd, I began the new meds of phase 2. I was on carboplatin and paclitaxel, and I was still continuing the immunotherapy, the Keytruda, every 6 weeks. Yeah, like I said before, my chemos at times were postponed a week or so due to your blood work results, because you get blood work a few days before you go for chemo. And if you're not stable, then they say, we're going to wait. We're going to let your body heal a little bit. So there were a few setbacks there. So I should have been done chemo a little bit sooner, but my body just needed that time to recover from the previous chemos. Phase 2 wasn't as harsh as phase 1 drugs, I would say personally for me. I still felt pretty crappy, like flu-like, stuff like that, but it was different, not as harsh. I didn't have the weird cravings anymore. I had my appetite back for the most part. So a lot of people do say that the phase 2 is not as bad, and I personally felt the same. Still it wasn't great. I still didn't want to, go out a lot. I spent a lot of time at home in my own backyard. Being that it was spring, a lot of time on my deck under my gazebo reading, just enjoying nature, just recovering and just resting. I was also put on a thyroid medication in May because immunotherapy does a lot of good things, but it does some other things too. It stimulates your thyroid and it can make the thyroid go a little wonky. So I was put on a hypothyroid medication to control that. They caught that in my weekly blood work. And I was also put on a heart medication because, again, immunotherapy, it has something to do, it stimulates the thyroid, which in turn does something to your heart, which I was getting kind of heart palpitations. So anytime I would have those heart palpitations, I would take the heart medication. Luckily, that just kind of stopped the heart palpitations. I wasn't on the heart medication for that long, so I'm no longer on those. It was just another thing to add to my daily bottle of pills. So yeah, having a racing heart was a little scary, but they were able to control that. My first phase 2 chemo, I did have a reaction in the chair. It can happen. My stomach started to rumble. I was running to the bathroom every 20 minutes. I had a tight chest and a tight throat. As soon as I told the nurses that, they stopped the infusion and just let me kind of gather myself. And they waited for a bit and then they restarted the medication. I believe it was like at half speed or something like that. And from there on, I was okay. So that's basically what they had to do every time I went to phase 2 chemo, is they'd have to start it off slowly. And then I think they gradually speeded it up just so that it wasn't such a shock. So that was really the only reaction that I had to the phase 2 initially. So I was also given a steroid, a little bag hung with my meds, like kind of like pre-meds before you get your chemo. And they help keep you kind of upright and stimulated. But they also did the same thing at nighttime. So they caused a lot of insomnia. So while I was on the steroids, I felt very agitated and just like my brain wouldn't stop thinking, wouldn't stop going, just vibrating. So I had to start taking a sleeping pill for a lot of those nights, like the days that I would get the steroids kind of thing. So just to relax me, because the steroids they just amp you up. So during the phase 2, I made sure to use ice packs on my hands and my feet while I was doing the paclitaxel infusion. There's no studies done, I don't think, medical proof that this helps, but the paclitaxel can cause numbness and tingling in your hands and feet, I've heard. They call it neuropathy. I luckily did not have that. So every time I would see them hang the bag of paclitaxel, I'd have my little lunch bag with my ice packs in it. I would just sit there with my hands on ice and my feet on the ice the whole time. It was cold, but it was worth it because I really didn't end up with any of the neuropathy that I've heard a lot of. I was still taking the Grastofil injections, not as often on the first phase, just every kind of once in a while, maybe once a week, once every second week, I think. I can't really remember, but they really kind of scaled back on the Grastofil during phase 2, because I guess it's not really as necessary to keep your white blood cells up during phase, like it is necessary, but I guess maybe your body can do a little bit better job on these less harsh meds. So I went through all my chemos. My final chemo was actually September 12th of 2023. I was put in touch with a surgeon for my double mastectomy, as well in touch with a gynecologist for my oophorectomy, because that's essentially what my next step was surgery. They were going to give me some time to heal, basically detox from the chemo, let my body rejuvenate, and then get into surgery. Like I said, my cancer really likes estrogen, so the oophorectomy was pretty necessary. I didn't see a problem with it. I am done having my kids, that kind of thing, and my period has stopped, so it was, and they were going to be doing it laparoscopically, which is a lot less invasive, so it was pretty simple. Yeah. So altogether, I had 14 chemo treatments, I believe, phase 1 and phase 2, and I was still continuing on with that immunotherapy afterward. By the time I had my last chemo, my eyebrows and hair had begun to grow back. I still had fatigue, but I was able to go out for an hour or so to run small errands with my husband, that kind of thing. He was pretty much by my side for everything. If I was having a really, really good day and I just wanted to make a quick drive into town myself, obviously he'd let me. So driving myself kind of felt good. It was a little bit of my independence back, but it was also nice to have him take me to all my appointments and just have that person there, hold your hand, reassure you. So I'm so thankful for him to have gone through all that with me, all that driving. So the plan for my surgery, like I said, was to have my body detox for a while. Around October 20th, I had my port removed, because I figured, you know what, I'm done with chemo. And I really didn't like the way it felt. It was kind of gave me the heebie-jeebies every time I brushed past, because it did stick out quite a bit from my skin. You could definitely see it. So I had that removed in a quick day surgery on October 20th. I didn't have any issues with the removal. The removal wasn't as invasive as the install, I'll say. So it felt a lot quicker. I think I was a little bit more relaxed as well, because I kind of knew what to expect. It was basically the same thing, but in reverse from when I got it put in. Hindsight, I kind of do wish that I would have kept it in. I am going through some issues right now. I've been in and out of hospital quite a bit in the last month or so, but I will be getting into that in my future videos. I just wanted to point that out. So might have jumped the gun on getting the port out, but it was my decision at that time. So on October 23rd, I went to get my ECGs and x-rays and all that for the upcoming surgeries. Things went normal and everything was good. On October 25th, that was the day before my surgery. I'm gonna put another disclaimer up here. So I will be telling you kind of the prep that they put me through for the double mastectomy. It's a little graphic, so if you don't want to listen to this part, just fast forward through. So like I said, October 25th was my dye day, I called it. It's basically where they had to inject a blue dye. It's like, I think it's a radioactive dye into my areolas so that the nodes could be found during surgery. The nodes that they had to remove, they kind of just, this dye just like lights them up so that the surgeon can find what they're looking for. It's called a sentinel node dye injection. So I just went to not my local hospital, but the hospital that I would be having the surgery at. I believe it was about an hour away. And what the nurse did, she did give me a numbing cream for my skin, just kind of around my nipple area. She's doing both because I was having a double mastectomy. Both were going to be taken. She gave me 4 dye injections, 1, 2, 3, 4, into each areola area. For me personally, this was very uncomfortable. The numbing cream didn't do a whole lot. I didn't have an Ativan or anything to calm me down. It was not pleasant, but it needed to be done. I'll say that 1 out of the 4 on each hurt more than the others for whatever reason. Maybe it was where it was positioned, but it wasn't great, but it was fairly quick. It was done within about an hour from start to finish, from the time that she had to come in and talk to me and explain it, put the numbing cream on, and all that. I was sent home and awaited the next day, which was surgery day. My double surgery day, where I had my oophorectomy plus my double mastectomy, was October 26th of 2023. I was only going to be put out once. I was going to be seen by 2 different surgeons. I was going to be seen by my gynecologist first, do the oophorectomy, and then the surgeon would come in and do the mastectomy, all in the same time when I was asleep at the same time. From start to finish, I believe it took about 4 hours. So the first thing that day, I had to go to the hospital, which was an hour away from my home. I had to have a guide wire placed on my cancer side so that my surgeon could locate the area that needed to be removed. I think it was like the node area or something like that. So they basically took, they scanned it. I can't remember what it was called, but they were looking around for the titanium clip that had been placed initially. And I think that's kind of where the guide wire was supposed to go so that they could find that initial bad node. They wanted to make sure that they got that out. So that, it's a tiny little wire. It's like the thickness of a fishing line, basically. So it was inserted into my cancer side, my right breast, and she just kind of taped it to the side. It was sticking out of me. So this was just all in prep for me going to the next hospital where the actual surgery would be done. So that was relatively quick. She was having a bit of a struggle trying to find the clip for some reason. I don't know. I think it might have maybe fallen somewhere. I don't know what the issue was, but she was taking a little bit longer than I thought should have been. But anyway, it wasn't that bad. So it was basically, yeah, just taped to my side, and I got back in the car and we drove about 10 or 15 minutes to the next hospital, which was where I was actually going to be having the surgery. I was feeling pretty calm at this point. I was taken to a prep room and asked a bunch of questions, having reassurance from the nurses. My general surgeon who was doing the mastectomy, she came in, she chatted with me for a bit. She kind of reassured me. and assured me, I'm in great hands and everything's going to go fine. So I was at that point, I don't know what came over me. I was feeling quite just calm and just relaxed. I hadn't taken anything, but something just kind of just calmed me. So I knew I was going to be okay. I was then moved to the actual OR room where the surgery would be taking place. My gynecologist would be doing this part first, the oophorectomy. And that's who was in the OR with his team. So yeah, the plan was for him to do his part, and then my general surgeon would step back in to do hers. And it's laparoscopic, so minimal scarring and less invasive with the oophorectomy. So they were getting me all ready to be hooked up to IV and for my sedation, things like that. And at this time, I was really starting to get quite nervous and anxious. I think I even started to cry because when you go into an OR room, it's just there's lights and there's people and there's tools and there's noises, and it's very intimidating, and you're just there by yourself and you get scared. So, but my surgeon, my gynecologist, he reassured me that you're in very good hands. He just kind of patted my shoulder and said, it's going to be okay. And I mean, I was pretty much bawling my face off, but it just all got really real right then. But within about 10 seconds of them hooking my IV up to my hand, I was out. So that was that. So altogether for both surgeries, like I said, I think it took about 4 hours. I was asleep for. I don't remember waking up in recovery, but I do remember waking up in my hospital room, and my husband and kids were waiting there for me. I was admitted so that they could monitor me. It wasn't a day surgery for me particular, maybe because I was a cancer patient and they really wanted to keep an eye on my stats and things like that. But I'm thankful that I was able to stay the night. It just kind of gave me that little bit of extra rest, not having to be rushed out right away. Altogether, I had 3 nodes removed on my right side, my cancer side, and I had 2 nodes removed on my left side, my non-cancer side. Just as a precaution, I think, for the left side. I'm not sure. I had woken up with dissolving stitches on my chest, and I think I had like tiny little like bandages on where they did the oophorectomy. I think there was 3 spots. They're very, very small. They were kind of near the belly area, like belly button area, and around my belly. I did not have reconstruction right away. I decided to stay flat. So I probably could have at that point had what they call a DEP reconstruction, where they take other parts of your body, like your stomach, sometimes the back of your shoulder, and they make you new breasts. I wasn't interested at that point. For now, I have decided to stay flat. I do have the option of having reconstruction done a year after the fact of my surgery. I'm still debating it. Right now, I'm just really just trying to heal. Not really looking for another surgery right now, but and I mean, there's always the chance of having a tattoo or something down the road, but I do have options. So for now, I am just staying flat. So what they did for me was called an aesthetic flat closure, I believe. So she basically got it as flat as she could. Quite happy with it. If you had to have a surgery like this, it turned out pretty well. So as I said, I spent 1 night in the hospital. I was feeling relatively pain-free. I was not given any kind of compression garment for my chest. That's usually at the discretion of your surgeon. She didn't give me one for whatever reason. Sometimes it helps with swelling, things like that, but I guess she didn't think that I needed one. So I just had bandages and steri strips, and I also had, I will say I had 4 drains. So drains are basically, they're put into your incision area here, and they kind of hang out of your body with little bulbs, and it collects the fluid from the drainage site of the surgery, just to keep the site cleaner, I guess, so that you don't get a extra buildup of fluid, infection, things like that. So I had to change or empty those daily. It's not really something that was new to me. My son, he has had top surgery in the past. So I kind of looked after his. So I wouldn't say I was a pro, but I knew what I was looking at. I knew how to look after them. So instead of only having 2, I had 4. I'm guessing maybe because I had the nodes and the breast area. So, and those you just kind of have to live with. You kind of can tuck them in a pocket in a sweater if you have one, something like that, but they do get in the way. You have to make sure you keep them clean, keep them emptied, make sure that there's no weird smells, that kind of thing. But it's basically just to hold the fluid that your body's releasing. It's kind of gross, but necessary. Around the 28th of October, I was home. I did get nauseous, likely from the anesthesia, which I had been so sensitive to in the past. I've other times that I've been put out, I don't take well to anesthesia. I do get quite sick. I had dodged that up until the 28th, and then it kind of kicked in. I didn't really have an appetite. I had a wonderful neighbor. We have a really great community where we live. I had a wonderful neighbor. She brought us a meal. She's like, "What would you like?" I made some suggestions. She made a big casserole. She brought that over, so that was amazing of her. So really quite thankful for our community and all the support that we've had throughout this entire situation. Many people have reached out asking if they can help, anything we need, helping with the yard, snow, all that kind of stuff. It's been amazing. I did have some pain in my belly area where the ovaries and tubes are removed. I was prescribed some pain meds that I had taken home with me. I will say I did get to kind of sort of celebrate Halloween. Halloween, if anybody knows me, is like one of my absolute favorite holidays. I love to decorate. Even before I had kids, I like to go to Halloween parties, things like that. But this particular year, it was a little bit more low key. I got to go out with a friend. She drove us around. The kids got to do their trick-or-treating. Might be their last year because they're getting older, 13-year-old girls, that kind of thing. So, but I'm very thankful to my friend who was able to take me out, and I was able to participate in that. I still had my drains in, but I kept them kind of covered. I mean, it would be kind of a interesting Halloween costume, I guess, if I really wanted it to be, but didn't want to gross people out, so I kind of kept them tucked in. And then on about November 2nd, I had 2 of my drains removed at our local home care office. She also removed some of the tape and the bandages. Getting 2 of those drains out was quite a relief because having to sleep with them can kind of be uncomfortable. I basically had to just like lay on my back and try not to move all night. I don't know how I did it, but I'm not a back sleeper, but something in my brain just said, lay on your back, don't move. So I was able to get through that pretty good. I did have a mastectomy pillow as well, which I kind of used to put across my chest and just kind of prop myself in bed like this. And I would go to sleep. And yeah, I didn't have a whole lot of difficulty. A lot of people say that they sit up in a recliner sometimes. I tried that. It didn't quite work for me. I preferred my own bed. So that was that. On November 5th, I got the last 2 drains removed, and it was a huge relief not to having be carrying around these, I called them udders. It was quite nice to not have that and have that freedom and not be worrying about pulling one out or something. I will say the right drain removal did hurt quite a bit for whatever reason. It almost felt like it must have been a little bit lower. And when she pulled, it kind of felt like I got kicked in the ribs, but it was quick, but it still hurt. But other than that, the rest of the removal, it wasn't bad. It was a quick pull, and they're really quite spongy kind of thing. I think the drain that was actually in me was about as long as a pen, I guess. So got all that yucky stuff out of the way. During this time, I was feeling a lot of tightness across my chest, probably just from the healing. I think I still had a little bit of tape and stuff on. I felt a lot of tightness across my armpit area and across the chest incision at this point in healing. I wouldn't call it what they call iron bra. A lot of ladies describe iron bra. I wouldn't say that, but it was quite tight, just like the skin wasn't where it wasn't sitting where it was anymore, right? Because they took my breasts, so they kind of squished it all down. So my body was trying to figure out where things were supposed to go. My nerve endings had been cut during surgery. Those were still trying to, revive. So a lot of feelings going on during that point. Like I said, my oncologist had also prescribed me with zoledronic acid to help with bone density issues, because the chemo can affect your bone density. So I got that drug on November 21st, as well as my immunotherapy at the same time. This drug, I will say, was probably by far one of the worst drugs that I have personally had. They told me that it would cause some flu-like symptoms. So I was, I'm ready for that. I've had that from chemo. That was not the case. My personal side effects were absolutely terrible that night. The night after, I got it in the afternoon, I went home and went to bed. I was laying in bed, and all my muscles just started tensing up so much to the point where the back of my neck, I could feel it crunching. It was just like every muscle in my body just was contracting. It was pretty scary. I knew that it was happening because of the drug, probably. I didn't consider it an allergic reaction. I just figured, what, it's getting into my bones, it's getting into my muscles, it's doing what it's supposed to do. But the pain and the side effects were not great. I had a fever of 38.4. I had severe chills. I could not stop shaking, so that added to the intensity of my muscles being contracted, shaking. My wrists and feet, it felt like I had old sprains that were re-spraining themselves. I don't know if you've ever had a wrist sprain or whatever and how that initially feels, but it felt like I had re-sprained my wrists, and I believe my ankles were really bothering me too. I've had past injuries, and it felt like it was all just happening all at once. It was horrific. As I had stomach cramps, my eyes hurt to move. I would say that easily that pain that night was a 7 out of 10. 10 being childbirth. So it was pretty bad for me. I was crying in bed because I was in so much pain. some of the worst pain symptoms I've had through the entire cancer treatment process was from the zoledronic acid. I started to feel a bit better about 2 days after that infusion. I was told that for many people this happens only the first infusion. I do have another one booked for May of this year, 2024. So with everything that's going on with me right now, I don't know if they're going to keep going with it. I guess I'll have to find out where I am as far as the diagnosis goes at that particular time. 4 days after that infusion, which was around my birthday, I was still having joint pain, still having insomnia so much even that my prescribed sleeping pills, they were not working anymore. I was just awake all the time. It was terrible. And then into the end of November, I was still having some joint pain and swelling, especially in my knees. My knees looked pretty puffy. My wrist was still painful. To do this was quite painful. It just felt like I had sprained my wrist again. I had puffy legs, puffy ankles. And by this time I was in full Christmas mode, or trying to be the best that I could. I had my tree up. I made an effort to do a little bit of decorating. My daughter helped, my 13-year-old daughter, she helped. She really likes Christmas, so I really wanted to try and make it special for her. So we did a little bit of decorating inside the house, nothing crazy. My pathology report from my mastectomy came back around December 7th of 2023. There was no evidence of disease found from my surgery, no cancer found in the breast tissue or lymph nodes removed. So that was a very, very happy day for me, to know that I think they got it all. The chemo did its job. For everything that I had gone through, it was definitely worth it. So I'm extremely happy for that report. That was my radiation oncologist who called me with that good news. That was the first time I'd spoken with him, because my next step was going to be radiation. I will say that I did notice as the months went on, as I was doing chemo, I did notice that the lump was going down. I couldn't see it before I could kind of see it, and it eventually it kind of just melted. I don't know how else to describe it. That's kind of how it felt. So my oncologist was very happy with the results. She said they couldn't have wished for better results. I took very well to the chemo. My body took very well to it. Between the chemo and the immunotherapy together, it did the job. I believe it was back in August that was my second MRI. It did show that my tumor had shrank from the initial 7 centimeters down to about 1.5. I could be wrong on those numbers, but that does show you that it was shrinking, it was working. The radiation oncologist had decided to do 16 rounds of radiation on me, just in case any cancer cells were left inside that they missed from the surgery, just as a precaution. So he said that, the benefits outweigh the risks. He had talked with other colleagues on my case. I guess my case was a bit of a different one. He was kind of on the fence for a while, but in the end, he did decide that he wanted to go ahead and do that last step of radiation for me. The titanium clip that was initially placed in the suspected node after they after they did the biopsy, they never did find that clip that was initially put in my in my initial breast biopsy. So I don't know where that went. It's probably still in me somewhere. Maybe it fell, I don't know, but they couldn't find it on the scans and things. So I'm hoping that, I think that that's another reason why they did the radiation, is because that clip was essentially attached to the node that was suspected to have cancer fluid in it. So because they didn't find that, they just wanted to really hit this whole area and just be really, really sure that they got it all. So I think that's kind of where I'm going to end this video for today. I will be making more in the near future. I do thank you guys for joining me. This was a lot to cover, a lot to get through, and I'm very glad that I finally got it out and onto my video. So I do thank you again, and I will see you in the next one. Bye, guys.